Let's see how this goes. We've been having a heck of a time this evening trying to get things started, but I think we got to go now. I'm Dr. John Edwards from Mama's Chiropractic. I'm here doing question and answers with the doc, and usually we're broadcasting from Amanda's Natural Market. Tonight we're broadcasting from my house. My partner in crime, Erica Sharp, is away at Montreal, and so I'm looking after our blue and gold macaw, Captain Pete, who's kind of nestling himself in. It sounds like we're getting a storm outside. So if every once in a while things get a little squawky, that's Captain Pete. Tonight we're going to be talking about things that I had come up over the last 2 weeks from parents or other people on Facebook that I've met asking questions about healthcare really from a holistic perspective. The first thing that I wanted to talk about, we were at a crab boil a couple weekends ago, and the topic of SIDS came up. And sudden infant death syndrome is something that, at least in the chiropractic literature, we've been looking at for quite a long time. Mainly because in the late 1960s, there was a Harvard MD who did some research. His name was Albert Tobin, sorry. And Dr. Tobin did autopsy studies on several SIDS cases. Did this research for years and years, and he was one of the first people to discover that the major cause, in his opinion, from these autopsy studies for the SIDS deaths was damage to the neurovascular structures, he called them, up near the brainstem at the top part of the baby's neck. And he said that oftentimes this neurovascular damage was apparent after the delivery in what he would term a microtrauma level. So that really means that there wasn't any real apparent problem with the baby when they were born, but during the, like some kids get immediately injured. You can tell they have cerebral palsy, or they stop breathing. There's a lot of those absolute trauma that gets recognized. But what he was saying is that there's this microtrauma that happens during the delivery that puts pressure and damage on the very upper cervical spine where the respiratory centers are located. And in chiropractic, we've talked about that for a very long time as one of the reasons why a baby should get checked after they're born. Because honestly, if I was going to take you by the head and I was going to pull you through an opening narrower than your shoulders, you'd probably want to get your neck checked out, right? So that's what we're doing. Is we're checking out babies for upper cervical misalignments, and some of the things that we find are really, really easy to check for. There's a test, it's called the cervical riding test, and it's laying the baby down on his or her back and turning her head to the right side, and then the natural inborn reflex is to have the whole torso turn that way too. And then the next part of the test is turning the head to the left side, and then their torso should want to roll along with their head movement. If it doesn't, then that's one of the indicators that we're using to determine that there's a misalignment up top that's causing neurological problems. Just from kind of a clinical standpoint, baby that I checked 4 hours after he was born, the midwife called me because he was having a hard time keeping his body temperature up. And I did the test with him, was finding that he wasn't responsive to the cervical riding test, checked that upper cervical area. And it's kind of interesting, for chiropractors who are used to adjusting babies, they'll all tell you that it usually only takes about 4 ounces of pressure to adjust an infant. Now, 4 ounces is kind of a vague concept. It's usually about the amount of pressure you'd use on a super ripe tomato when you push in with your thumb before you go through the skin. So it's really light. I mean, if you've ever imagined what the inside of a baby's spine looks like, there's a lot of space in there. So it doesn't take a whole lot of pressure in order to just encourage a vertebra back in. It's more of just a set and hold type of adjustment. And I did that over a period of time until I felt some indicators that I look for are either heat in the area or sweating, anything that's telling me that I've got some sort of neurological change. And then at the end of that, I found out from the midwife within the next half hour his temperature started to stabilize. So, those kinds of things. So we've been doing blood pressure studies on adults finding that upper cervical misalignments help regulate blood pressure. There's been studies for people who came in with hypertension, had their blood pressure lowered about 2 points, about 14 points, which is about the same as 2 blood pressure medications combined. There's another study that looked at patients with low blood pressure and found that, and I've had this happen with me too, found that adjustments to the upper cervical area actually boosted the blood pressure up. So what we're looking at isn't like a cookie cutter approach, a mechanistic approach to saying, well, you know, if I've got a left atlas, then that means that means high blood pressure. If I've got a right atlas, that means low. The body doesn't physiologically work that way. But what we do know is that if we're getting facilitative extra noise in on the neurology up top, that can have pretty important effects. So I was mentioning the cervical riding reflex and the tie-in with SIDS. One of the theories then is that if we have a baby who doesn't have a proper cervical riding reflex left or right, that's a hardwired innate neurological reflex. And if we have a baby who's, let's say, laying on their side or laying on their tummy, or they're sleeping with mom, and they aren't able to naturally reflexively turn their torso when they turn their body, one of the things that we're wondering about with things like suffocation with SIDS is if that tends to impact, if that's one of the reasons that we've got a problem. It's because if we have neurological and vascular damage up at the upper cervical spine and we're failing that cervical riding reflex, does that endanger the child? Does that get the child more prone to something like sudden infant death syndrome? Now, part of the conversation we had with Crab Boil was about the different factors associated with SIDS. We know that smoking can be related with SIDS. And I started doing a little bit of research on some possible mechanisms on why that could be. We do know that nicotine in cigarette, especially secondhand, and we're also doing studies on third-hand smoke, just the chemicals, when you go into a restaurant that has smoking. I mean, hard to find nowadays, but you come home and you can smell kind of smoky. That would be kind of like a third-hand smoke. The chemicals are still there with you. We found that that those kinds of chemicals do cross over onto the baby, and if we have things like nicotine, which is a stimulant, coming into the bloodstream, chemically what we're doing is we're raising that sympathetic nerve system, that fight or flight system. You're putting a stimulant into a nerve system that's already overstimulated. How does the neurology respond to that? Well, in the case of something like ADHD, treating that with Ritalin, the way that the medical establishment had been treating children with attention deficit disorder was to overstimulate them, was to give them essentially an amphetamine in order to take an already cranked up nerve system and push it over the edge. Give it a new threshold, a new way of, it's called depolarizing. With nerves, the way that a nerve will work is picture a little bit of, it's called an electric voltage potential. So picture a graph that we've got to get up to this peak here. And the way that the nerve works is that a signal comes in, whether that's a chemical signal or an electric signal, they work very similar. And it comes into the nerve and it builds up towards that peak. And as it continues to build up towards that peak, once we get to the magic, it's called threshold, then the whole nerve will contract, shoot off an electrical discharge, and send the information along to the next neuron. So one of the ideas behind giving a already amped up kid more amphetamine is that it changes the threshold at which the body starts to depolarize. It changes the ability for that nerve to withstand kind of normal stuff, but it kind of puts them in this zombie state. So that's kind of when I was doing some research and thinking about how does cigarette smoke impact SIDS, that's what seemed to make the most sense to me. That we have a already irritated upper cervical neurology where all of the respiratory centers are. And if that irritated neurology, high in inflammation, high sensitivity to threshold for depolarization, if we're putting more stimulants into that system, then that's going to raise the threshold for that baby of the amount of outside stimulation it can take before the nerve fires. That's not necessarily a good thing, right? Because if that stimulation is something like rising carbon dioxide levels in their bloodstream, That's what helps them drive to breathe. And it takes a higher and higher and higher level of CO2 in order to excite those neurons because they've been so overstimulated. That might be one of the reasons why we're not having babies survive. If it's something like a blanket's on their face and it's over their mouth, and that's not enough information into the nerve system to make the baby want to turn their body so they can get more oxygen, if that threshold's being raised and raised and raised because of chemical irritation, then it makes a lot of sense to me that that might also be a contributing factor. So, obviously the smoking can be part of it, but is that the cause? Is that the source? I'm going to say no. I'll say this over and over again, that doctors and midwives and health practitioners who perform births really do the best job that they can. But it's still physics, and you have a head that has to come out through a very narrow opening, and that's a tough thing for anybody to try to go through. One of the things that I will always say is that after delivery, get that baby checked out. There's very basic tests that chiropractors who know how to work with children know how to do. We get trained to do them, and the adjustments can absolutely, in my opinion, be life-saving.